Hidradenitis Suppurativa Care Beverly Hills CA. Hidradenitis Suppurativa, HS, Care in Beverly Hills CA, otherwise known as acne inversa, is a chronic, long-term, skin condition affecting the apocrine sweat glands, which are most predominant in the underarms, groin and onyogenital regions. It is an inflammatory skin condition caused by the malfunction in the body's immune system resulting in scarring and recurrent infections of the apocrine sweat glands and their associated structure. It often presents at puberty and continues to progress over time. It can affect multiple areas simultaneously. It affects 1 to 4% of the US population, till to 3 to 12 million people. Often starts out as a small infection like pimple or boil that progresses to abscess, pockets of infection, which eventually opens and drains resulting in repeated scarring. This continues to progress and worsen with each recurrence. Despite no clear racial predisposition, there is one study that does indicate an increased incidence in African Americans due to higher density of sweat glands. Both men and women are affected. HS is not well recognized by most of the medical community and often goes undiagnosed or misdiagnosed. Thus proper treatment is often delayed. Once proper treatment is performed like that by Dr. Sohm and his expert team, the cure rate is over 90%. We offer a variety of treatment options including medical, laser and surgical. Treatment plans are tailored to each individual and options will be discussed after extensive evaluation by Dr. Sohm and his expert team. Staging of HS is most commonly based upon Hurley's classification. Stage 1, single or multiple abscesses without sinus tract formation or scarring. Stage 1 is most common. Stage 2, recurrent abscesses with one or more sinus tracts and scarring widely separate by normal skin. Stage 3, diffuse involvement with multiple sinus tracts and no intervening normal skin. Indications for surgery. Treatment plans are tailored to each patient based upon their history and physical findings associated with their hidradenitis suppurativa, HS. Based upon their class of HS and current state, we will then discuss the appropriate and best options for treatment. If there is an acute infection, then we will often start with treatment with antibiotics first, then proceed to more definitive intervention for cure. Options as mentioned below include resection with and without reconstruction for surgical procedures as well as less invasive options for the lesser cases and presentations of HS. Dr. Sohm and his expert team will take the time to discuss all the options as appropriate for each patient and come up with a treatment plan that works best for you. Surgical techniques. Incision and drainage. Disease resection and leave open to heal with local wound care. Disease resection and closure using the following methods: skin grafts, local tissue rearrangement or flap reconstruction. Cure. After years of work and review of our experience, Dr. Sohm and his expert team have a greater than 95% cure rate using a combination of the treatment methods discussed including resection and reconstruction of HS affected areas. We will work with you to provide you a pain and disease-free lifestyle. Please call for a consultation about your hidradenitis suppurativa in Beverly Hills, California area 310-919-4179.